From KPRC 2, this is Houston Newsmakers with Cambrell Marshall.
Good morning. Thank you for joining me. I had a much different program planned for this Sunday, but after what happened last week to some of our children, I knew that I had to change the topic. From the beginning of the week until the end, we saw headlines and heard horrible stories about the fate of some of the most precious in our community, our children. Here's a sample of some of our reporting that emphasized to me that we need to find something better.
Tonight, investigators securing evidence, including the shotgun they say a 10-year-old used to accidentally kill his 8-year-old brother.
I'm sad that this child died.
A $15 million bond set for the woman accused of killing her 5-year-old daughter.
Officers stated that the defendant made a non-custodial statement to that officer stating that she made a conscious decision and needed to end the child's life.
Horrified, hurt, abused, desperate. You're watching the moment two 16-year-old siblings took their lives and ran for help, finding a neighbor, showing the handcuffs they say their mother made them wear.
She kept shaking and she was like, my mom's kept us locked in the laundry room, just scratches and bruises all over his arm. Both of them had severe scars around their wrist.
The search for a missing and endangered 2-year-old stretched into a second day, expanding from Memorial Park in Pasadena to Milby Park and Moorebridge Jackson Hill Cemetery.
I think we did a good job yesterday clearing a lot of areas, and we can say we know where she's not.
The look on the face of 2-year-old Nadia, enough to melt your heart. And as of this taping of this program, there's no word on where she might be, but her father, who is accused of killing her mother in front of 2 other children, is suspected of being responsible for Nadia's whereabouts. Hope is not high that she would be found alive. It is with that background that I introduce this morning's guest. Dr. Bob Sanborn is the president and CEO of Children at Risk, whose bottom line is to improve the quality of life for children through research, education, and advocacy. Amy Smith is the Senior Director of Operations and Communications for the Harris County Domestic Violence Coordinating Council, which this week was announced it will be responsible for distributing more than $4.5 million in domestic violence in that assistance fund. I know that all the deaths that we talked about are not attributable to domestic violence, but certainly some of them are. And I know that as I watched some of the reports last week, Bob, I saw you one of the weeks. I think we're talking about the teens that were in the laundry room. I don't think I recall ever seeing you that angry about something, and you indicate that what you saw was a failure on the state level.
Yeah, I think the first inclination for many people to say, what horrible parents. But when you look at this as a whole, this is a failure of our leadership in Harris County, in the state of Texas. We're not really prioritizing children when we come to legislative initiatives, when we come to some of the rules that we're doing in our state. We completely underfund child safety in our state, and we're not really thinking outside of the box of how we're going to present this stuff. People lament what's happened, and people say, I wish parents were better, but we're not really taking action. And that comes down to mental health, down to parenting, what we're doing in our schools. We're not really being proactive. And so it's a huge failure on the part of Texas. And we can compare to other states. Other states are doing a much better job, but we have 1/10 of all the children born in America in our state, and we're not doing the job necessary.
Your Children at Risk, part of what it does is advocacy, part of it is education. Sounds to me like the education piece is for a whole wide range of people about what needs to be done.
Yeah, absolutely. I think when we do awareness and education, we continue to talk about some of these things. But I think the big action is going to happen at the state legislative level, right? We're going into this next legislative session. We have a huge surplus in the state of Texas. This is the time when we need to demand more of our leaders in terms of taking care of our most precious commodity, our children. And, I don't think something's going to happen around this, but I want there to be this outrage. I want people to be demanding more of our state legislature in terms of taking care of our kids.
Amy, I know you had a big week last week. The announcement, Harris County Domestic Violence Coordinating Council is going to be responsible for helping to dole out $4.5 million to organizations that are on the front lines of domestic violence. And as I said earlier, I'm not insinuating that all these children were impacted directly because of domestic violence, but clearly our children do become victims of domestic violence in some way, shape, or form. How is this money going to help, you think, on the front lines?
Well, Kimber, one of the things that you have to consider is that one of the things that our agency does is we facilitate an adult violent death review team. And what we found is a lot of people don't know how to have a healthy relationship. And so it's really important to talk about healthy relationships and talk about prevention, and getting into schools to talk about prevention and talk about healthy relationships. The money that we are receiving from through Harris County are ARPA funds, so it's a limited amount of funding, and it's going to be used for grants to our community partners to give like direct assistance to domestic violence survivors for housing, for if you need a car repair. It's going to be a flexible funding account so that you don't have to go through this long list and long ways to get the money. And it also can help with child care, because we don't have enough child care. It can help with allowing housing, allowing transportation, anything that can help. It could, having the survivors go back to school. You talked about, and we talked offline about many of the boards and councils that you're a part of, unfortunately, that deal with the sad part of domestic violence, children hurt and killed. Talk about the challenge of sitting on all those different positions and knowing that that's a real problem that's still out there and it's not going away. Well, and as you said, I'm on the Harris County Child Fatality Review Team, and I'm also on the state Child Fatality Review Team, where we reviewed child deaths. And it's heartbreaking once a month to listen to all these children that are dying because I think Bob's right. We don't have enough resources. You know, a lot of the cases that review aren't necessarily just violent deaths. They're co-sleeping. They're not having a place for their child to sleep. It's drownings. It's, you know, there's all sorts of things. You know, violence is just such a small part of the Child Fatality Review Team, and talking about what we can do with kids. And I think Bob's absolutely right. We need more funding for children. So with Children at Risk, you offer a lot of different programs that people could take advantage of, but a lot of times the people who really need those programs, they don't know that they need them. Right. What's the challenge of trying to make sure that it can be right there in front of them, or at least put on them so that they have to take some of these programs or learn to be better parents, to be better custodians of these children that are precious commodities? Yeah, we passed a piece of legislation a number of years ago asking parents to be more educated, right? So when a baby is born at a hospital, can the hospital sort of offer classes on parenting and so forth? And that law is being regulated by hospitals really giving a couple sheets of paper on this is what it means to be a good parent. We could be more proactive there, right? We could be doing much more as a community in terms of funding some of the high quality parenting programs that are out there. A couple of years ago, we passed a piece of legislation saying if the state is going to support parenting, it had to be evidence-based. That was a very good step, but we're still seeing not enough parenting going on out there. And all across the board, Kimbrough, what we're seeing is that we're underfunding a lot of these types of programs, whether it's parenting, mental health, early education. This is the problem. Well, we're going to talk more with Dr. Bob and Amy after the break when we talk about maybe possible solutions to some of the horrific challenges that we've been seeing, some of these children in our community. Terrible things have happened to them before they get a chance to grow up and be contributing members of our society.